Hi you guys. Okay, hopefully this is working. It is 6 o'clock Pacific Standard Time, so we're just doing a live Q&A this week for YouTube. Usually I post a YouTube video on like a certain topic that you guys want to hear about, but I feel like I wanted to engage with you guys and answer your questions in real time, so you don't have to wait for me to get back to your comments. And sometimes I'm not able to get back to everybody's comments and questions, and you guys have the most insightful questions and comments in my videos, and because I can't get back to them, I just figure that maybe if you guys like this format, I can maybe do a live Q&A with you guys once a week. And let me know in the comment section if this is something that you guys would enjoy, because instead of doing one video every Sunday, I could maybe do 3 videos every Sunday out of the month, and then one Sunday out of the month we could do like a live Q&A, just because you guys have the best questions and I just feel bad for not being able to get back to everybody. But usually I'm in my office seeing patients, and I'll get back to as many comments as I can within the first 24 hours of posting a video. But then once the work week hits and I'm seeing patients and doing procedures in the office, I'm not on my computer or on my phone like on YouTube. So I'm posting shorts and stuff, but I'm not really able to answer your questions and your comments, which are very insightful. So I want to be able to do that for you. Hello, happy Sunday, guys. Okay, and it's also really cool in this chat, like to be able to see your questions. Okay, so let's get through as many questions as we can. We're gonna do 30 minutes and a 30-minute live Q&A. And again, if you like this, leave a comment in the comment section and I'll do more of this. So if I don't get to your question, I'm sorry, I'm gonna get to as many questions as I can. So, okay, so someone asked, does LaserMD tighten skin? I don't have any personal experience with that, but I've heard good things. Just be really mindful if you're getting this done in a med spa or, at a third-party kind of provider. Just make sure that he or she who's doing the procedure on you is very well versed with the device, and you see his or her own before and afters, not like before and afters from the company, but ones that individual has actually performed. So I've heard good things. I can't say anything about it from personal experience, but I haven't heard anything too negative about it. So somebody said, happy Sunday. Hi, hello, hi you guys. So good to see you. Okay. So somebody asked, what are the current stretch mark lasers and what are their efficacy? So if stretch marks, what we call striae in dermatology, S-T-R-I-A-E, when they're new, they're usually more erythematous or pink or like a red kind of color. Then they mature and they become more like a white discoloration. And if you look under the microscope at stretch marks, it's just a dysregulation of the collagen fibers, and the collagen fibers in the skin, which make up the extracellular matrix proteins in the dermis in the skin. And when you have like a growth or stretching of the skin, or you have, you're growing as an adolescent, or you have pregnancy, or you have a weight gain or loss that's rapid, sometimes those elastin fibers like freak out and they lose their structural integrity and support. So they cause these stretch marks. So when they're red, usually V-beam is the standard of care. V-beam is a 595 nanometer wavelength laser that targets red. Hemoglobin is the chromophore. Sorry, I'm being scientific. Let me know in your chat if it's like too scientific, and I'll kind of water it down. But in English, basically what that means is V-beam is attracted to red. So the redness in the stretch marks will respond best to V-beam within like the first year or two after the stretch marks have become apparent. Then after time, like say, you want to reverse stretch marks that happened during a pregnancy 8 years ago, usually that's more Fraxel or some type of resurfacing laser. I love Fraxel because it's a non-ablative laser resurfacing device that is great for like stretch marks, acne scars. It's amazing for a bunch of different things. It actually was just recently shown in a Harvard study to decrease skin cancer by 50%. But it also is one of the my favorite treatments for stretch marks, because I've used every laser, every device out there, even ones that have not even been launched yet and are going through FDA clinical trials. So I feel that a CO2, an Erbium, Halo, those can also work too, but I feel like from my experience of Fraxel Restore, which is also known as Fraxel Dual, because there's 2 wavelengths, and within those 2 wavelengths, the 1927 and the 1550 nanometer handpiece, it's the 1550 nanometer handpiece that is best for treating striae. Usually you need about 3 treatments spaced 1 month apart, and then wait a couple months to see your response to that. And then if you need more, then you can do another series or just 1 or 2 more. And usually like it accumulates over time and you'll have an improvement. Now the improvement window can range anywhere from like 20% to like 80%. It just all depends on your skin type and just like the nature of your skin. So I always say just, it always requires multiple treatments, but don't be sad if immediately after you're not seeing results, because it does take time to manifest those results from the laser. So hopefully that makes sense. All right. Love the Q&A idea. Okay, good. I'm glad you guys do. I do too, because I feel like I'm like hanging out with you and I can answer your questions as if we're in clinic together. Mine is having to be in clinic where I'm like in the comfort of my own home. You guys are in your own home. I'm about to go to the gym, so sorry for my gym attire, but I just got back from the store and I'm about to go to the gym. And when I was at the store, I was vlogging for you guys for the next video, so that'll be exciting. Okay, so somebody said, are gels more potent than creams with retinoids? Great question. Okay, the difference between a gel and a cream is a gel is the particle suspended in an alcohol-based emollient or vehicle. So it is more strong than a cream. A cream is basically an oil in water emulsion, or is it water in oil emulsion? I think it's actually a water and oil emulsion, and so it's a little bit more hydrating on the skin. So basically, to put things in perspective, if you have like a 1% gel and a 1% cream, the 1% gel will be definitely stronger, even though they're the same percentage, because the vehicle makes it stronger and increased potency. So when you're talking about like a tretinoin, for example, vitamin A derivative, people get hung up on the percent, right? Is it a 0.025%? Is it 0.05%? Is it a 0.1%? But what they don't pay attention to is it an ointment, a gel, a cream, a micro emulsion, like Retin-A Micro was a micro emulsion of Retin-A. So the vehicle can increase the potency even if the percentage is the same. So just keep that in mind. But yes, gels are more potent. So be careful because you don't want to fry your face off. Okay. Hi, Stephanie. My name is Christina and I'm from Orlando. Hi, Christina. You're so sweet. I love your videos and think you are such a great inspiration for young women interested in STEM. Oh, good. I'm so glad. I work sometimes at my kids' school, and like the STEM courses are just, it's just so awesome to see kids who love science and adolescents and young adults who love science as well. So I'm glad I could be inspiring to you, and thank you so much. I was always a math and science girl. I've loved science my whole life, and it's good to be among my fellow nerds who love to understand like the science and pharmacology behind a lot of the skincare products, and also the pharmacokinetics and physics of a lot of devices that we use in dermatology. So thank you for nerding out with me, and I can speak sciencey all day long. It's like my primary language. Okay. Somebody said, thank you for your time. You're most welcome. Somebody said, hi, Stephanie. Is there a laser that can get rid of sebaceous hyperplasia and dermatofibroma? Also, is there a laser that can be used on the lips to make them rejuvenated, plumper? There's not really a laser that can be used on the lips except for the same resurfacing lasers that we use for the skin, you know, a Fraxel, Clear and Brilliant, even a CO2. Sometimes when people have a lot of like, it's called actinic cheilitis, a lot of like sun damage on the lips, will do an ablative laser like a CO2 or an erbium, or a non-ablative laser like a Fraxel Restore, and that can help, but it won't really plump the lips. Really, the way you plump the lips is by topicals. You know, we just launched our MDR peptide lip mask, and like, you know, things that are going to hydrate the lips to allow those skin cells to hold onto water, restore the barrier, and just plump up the lips internally from a cellular level, or by like passively, you know, injecting hyaluronic acid like filler. I think you guys all always refer to the story that I told you guys about that mountain man who comes into my clinic once a year. This guy's like a full-on mountain man, like a beard, has an axe, like a plaid flannel shirt, and he comes in and he gets like Vobella in his lips because it keeps his lips hydrated. Vobella is FDA approved for lip hydration. It's great for chapped lips because you're basically injecting the hyaluronic acid inside the lip and it pulls water in, and yes, it makes them plump and beautiful, but it also hydrates the lips. So that was the one part of the question. And then the other part of your question to answer, is there a, sorry, I'm talking fast. It's just my brain goes fast and I want to get through as many questions as I can. Somebody said, is there a laser that could get rid of sebaceous hyperplasia and dermatofibroma? So sebaceous hyperplasia, yes. Dermatofibroma, no. So sebaceous hyperplasia usually responds, there's certain lasers that are actually engineered to treat sebaceous hyperplasia. There's one called smooth beam laser. It's a really hard laser to find. I had it in Northern California when I trained at the Laser and Skin Surgery Center of Northern California. I believe it was a, I can't remember the wavelength. I want to say it was like a 10600. I don't remember the wavelength. now I'm going to get hung up on what the wavelength was, but it was a smooth beam laser that targeted the sebocytes, the sebaceous glands. Also, if you have like a little electrocautery device like I have in my office, you just use a little Appalachian tip that's a little skinny tip, and you basically desiccate the sebaceous gland hyperplasia that's comprised of sebocytes. And what happens is you see the papule just shrink, and it makes this little white head because all of the sebocytes, the sebaceous gland cells, release their sebum, and then they involute and they go away, which is really, really nice. I treat sebaceous hyperplasia a lot in my office. You can decrease their incidence by Fraxel, Clear + Brilliant, and other resurfacing lasers, but there are specific lasers specifically engineered for sebaceous hyperplasia. Aerolase, I think, is one. I think Ultra Clear. There's a couple more. They're all like brand names, so I only know lasers by their wavelengths. But dermatofibroma, dermatofibromas are different. Dermatofibromas are an overzealous synthesis of collagen, like not in a good way, but in a bad way, where you get, it's called the positive dimple side. When you pinch your skin, it's a little like hyperpigmented papule that when you squeeze, it kind of like involutes and pulls in, and it's called the positive dimple sign. And those you actually, unfortunately, have to excise out. So you usually do a little punch biopsy, which you take a cylindrical shaped kind of scalpel, and you do like a cookie cutter, and you take it out and you sew it together, because there's no way you can like inject it or make it go away with a laser. So dermatofibroma is just those little annoying papules. Usually you get them on your leg if there's like an inflamed hair follicle, or like a bug bite, or like an acne lesion, something that like kind of aggravated the skin and made those fibroblasts make overzealous production of collagen, but like in a localized scar-like form. So it's like a little papule. So unfortunately, those have to be removed surgically. I say surgically, but it's like a little punch biopsy with local anesthetic, not a big deal at all. So follow up with your dermatologist though for appropriate treatment. Okay. Hi, doctor. What do you think about Tixel versus Fraxel on the neck and face? I like both. I don't have a Tixel, but I think I've heard a lot of great things about Tixel. Tixel is kind of like a weaker, less strong laser, but I've heard great things about it for the neck and under the eyes. I don't have one because I love my Fraxel, but it's kind of like, just because I don't have a laser doesn't mean I don't like it. It's like, you know, if you could have, it's like in the category of like Fraxel, Clear + Brilliant. Tixel is a fractionated resurfacing device, and it's a little bit more, it's kind of like Clear + Brilliant. It's a little bit more mild, but I love it, and I have colleagues who recommend it under the eyes. They have great response to that too. Neck, you probably wouldn't want a little bit bigger gun like a Fraxel. Like I don't usually even recommend doing Clear + Brilliant on the neck, because Fraxel is just like the master of like resurfacing neck and reversing sun damage, stimulating collagen. I mean, I just had oh no, I didn't have Fraxel. I just had actually picotoning last week. Stephanie, my amazing laser nurse, did picotoning on my neck. So I get melasma here and here on my neck, and she was able to picotone that off. But I do Fraxel on my neck once or twice a year, and usually that's my favorite treatment for it, for myself and for my patients too. But Tixel, I've heard great things about too. Okay, benefits of low-dose Accutane. Gosh, I have some right here. Benefits of low-dose Accutane. So, you guys know I'm always honest and forthcoming. It's a controversial topic. Accutane, which is isotretinoin, is a vitamin A derivative, just like tretinoin that we put on our skin, but it's an internal, vitamin A supplement, or prescription strength drug rather, that we take. It has a bad rap because it has a black box warning, because it could have a lot of deleterious side effects, not only with abnormalities in your labs, but should someone become pregnant, it can cause birth defects. It can also, in very high doses, like they used to prescribe for acne patients, usually adolescents on acne medication, it can cause, sometimes it's hard to distinguish, but there was a thought that it could be correlated with depression, but usually adolescents who are dealing with and struggling from cystic acne can be depressed from that and like socially withdrawn. So there's a lot of black box warnings and, badness out there about Accutane. However, a lot of dermatologists, including myself, will take like a low dose 20 milligrams of isotretinoin once a month or once every other week. I do it, a lot of my colleagues do it. It's hard to get a prescription for it though, because you have to go through the iPledge system, and you have to be, taking labs and doing in-service kind of like questionnaires from iPledge, which is a government regulated way that they distribute the Accutane. So if you have a provider and you can get access to Accutane. It's not a bad thing. I don't want to recommend it. And also this live Q&A is by no means like medical recommendations or diagnosis and treatment recommendations. This is just like a Q&A, but I always ask you to follow up with your dermatologist or your primary care provider or whoever's taking care of you to have these discussions. But yes, there are benefits of doing low dose Accutane, but low dose means 20 milligrams once a month, once a week, not like 80 milligrams every day, which is the way that they used to prescribe it for acne for adolescents back in the day. But it does downregulate your sebaceous glands, it cinches up your pores and gives you that like porcelain skin. So a lot of us really like it. So I'm on it sometimes, I go off of it sometimes, but I think I've been on it for like the last couple years, and I really think that it has a positive effect on my skin. I also think my low estrogen birth control pill does too, but that's another discussion for another time. Okay. What do you recommend for surgical scars? Usually laser resurfacing is the best. Usually Fraxel is my favorite for texturized scars. If there's redness, any redness laser like V-beam. I love V-beam, I think it's the best, but there's also like KTP, XLV, lots of other red lasers to get the redness out if your morphological change of your scars more predominantly red. If it's hyperpigmented, I love Pico, I love a YAG, a Clear and Brilliant, a 755, and I think that for texture, Fraxel Restore is one of my favorite lasers for scars. Now, if you want something smaller or like less aggressive, no pain, no downtime, you go Clear and Brilliant. If you want something a little bit taking it up a notch, I would go with like a fully ablative or a CO2 or an erbium. It depends on the type of scar. If it's an acne scar, I would say a Fraxel Restore. If it's a surgical scar, maybe a Fraxel or maybe even like a CO2 or an ablative laser. All right, hello, Stefani from Brazil. Oh my gosh, hi from Brazil. Oh my gosh, good to see you on here. What do you think about Physic exfoliate? I don't know what FISIC. I have to look that one up. Actually, let me screen grab it and get back to you on that one, because I'm not familiar with that one, or if that's even in the US. If any of you guys are familiar with it, please drop a comment in the comment section, but I'll get back to you on that one. But hi from Brazil. Could you please discuss how we can find qualified providers local to our area? So I did a whole YouTube video on how to find a qualified provider. You guys, 90% of the aesthetics industry are people crossing over from other specialties trying to make money, because the medical system and the whole medical industry has just been upside down after COVID. So people are just trying to make money because it's a very lucrative industry. But those who've gone the traditional path of the last 30 years out of a passion for it are in the same kind of medical communities, these people who have no training and are charging very expensive prices for very expensive treatments that could either harm you or not work at all. So just make sure that you look at their credentials. I always say, whoever you follow on YouTube, look at their website, the provider's website, and look at their credentials. They will say where they did their residency, where they did their school. We all do. All of us who've done a derm residency, it's in our CV or in our credentials. All of us who've done a fellowship in lasers or procedural dermatology, it will be there. If it's not there, they probably don't have it. And that's not to say you can't go to them, but if you really want the creme de la creme and the highest possible trained provider, that's what you look for. There's a lot of extenders that work under these people. And so just make sure that if it is an extender, that you feel comfortable with them. Ask them questions. Like, don't be afraid to say, how long have you been doing this? Why do you like this device? Is this a new device, or did you buy this from a third-party laser broker for like a third of the price and it doesn't work well and it's not updated technology? Because that happens a lot. And people come to my office all the time saying, hey, Dr. Kappel, can we buy some of your lasers off you? And I'm like, no. What are you going to do? Recycle them to some, other med spa and sell out the parts and swap off the parts and sell them on the black market? No. You always want to get devices straight from the company, so the most updated software, and you know that they're tip-top shape, and then also have a provider who's highly trained and skilled. So watch my video on how to find a provider in your area. Hopefully that will be helpful. Okay, do you follow Amir Kasim here on YouTube? I do not, but I can look him up. Make sure he's a dermatologist, so if he's giving skin advice, because half these YouTubers are like primary care physicians and family practice physicians and pediatricians, and not to say that they don't know anything about the skin, but they didn't pass the dermatology boards and they're not keeping with their board certification in dermatology. So I don't know if you want to be getting advice from them. It's lucrative, so they'll be on YouTube, but most of the most most of the most astute physicians and clinicians aren't on YouTube. They're in the clinic seeing patients and diagnosing and treating and doing these procedures, or they're in the research labs doing groundbreaking research. I'm kind of this hybrid because I see all the badness that happens in the aesthetic industry, and I try to like compensate by empowering you guys, because I can't stop what they're doing out there, but I can give you guys the tools to inform yourselves and educate yourselves so that bad things do not happen to you and you don't waste your money on things that don't work. All right, so let's see. You're amazing. I would say thank you so much. You guys are amazing too. Are you taking new patients? I'm in consultation. I'm in Pasadena. Yes, I am taking new patients. It may be a little bit of a wait, but once you get on the wait list, and there's cancellations that happen every day all the time, and we'll send an email blast out, and then if you're on the wait list, then you can usually get in sooner. So thank you so much for that. Okay, so somebody says, does Ellacor, can Ellacor be done in conjunction with Agnes RF? It can. I wouldn't do the same day, but yeah, they can be done at the same time, but not like in the same day treatment, but like maybe a week or a month apart. Yes. Hi, Dr. Stefani. I'd love to know your go-to on lip care routine at home. Oh, I can't wait to try a lip mask. So I definitely have been using my lip mask for, gosh, the last year. It's taken us a year to perfect it. I'm always really mindful of always like putting on a lip mask, my peptide lip mask, before bed, because you're going to be sleeping 6 to 8 hours without drinking or licking your lips, or having it be able to be absorbed. And so I always be sure to drink plenty of water, because your lips and your under eyes are the first to shrivel up when you get dehydrated or don't have enough fluid intake. And just make sure that you protect your lips with a lip mask. Some people say drink water before putting on the lip mask, but honestly, I don't see any sound research clinical data behind that, behind that method, but I guess it can't hurt. And if you're at altitude, or if you're in a dry climate where the humidity is low, humidifiers and diffusers really help to keep the moisture in the air, so it's not pulling, through from your lips and drying your lips out. So I will post a lip routine, but it really is just maintaining hydration and putting on my lip mask before bed, when I wake up in the morning, and then, if I can throughout the day. Whenever I reapply my lip gloss or lip liner, I always put my peptide lip mask on first and then put those things on over it. So I always just don't want to miss that opportunity. And I literally have like a lip mask by my bed, in my bag, in my car, in my gym bag. I have like 10 of them all over the place, so I can just always reach for it and have it handy. I do that with sunscreen too. Okay. What do you recommend for hypertrophic scar in African American skin? Thank you. So this is a great question, and a large part of my laser fellowship training was treating skin of color. So that's my specialty, skin of color, laser treatments, and you have to be very careful with the wavelength. So the laser that you choose to treat, depending on your skin tone, and then the settings. And you have to look at the endpoints. The endpoints, I'm going to train you guys to be little laser specialists. Endpoints are the skin changes that happen, and they're different with each laser. So for example, with a Pico, which would probably be a laser that I would recommend, on African American skin for a scar. Pico, it's a brisk epidermal whitening. What does that mean? The skin kind of gets this whitish color. It doesn't ulcerate, it doesn't not turn white, it doesn't turn dark, it turns like a brisk epidermal whitening that happens fast, and it's actually air bubbles in the skin that don't shatter the epidermis, but they occur, and that's how you know you have the right wavelength. Again, this is not a lecture course, this is not medical information, I'm just exchanging ideas as just someone on YouTube who has a lot of experience in this industry, but I would probably recommend like a Pico or even like a Clear and Brilliant 1927 nanometer handpiece for like the pigmentation. If your scar is textured, we could do a Fraxel, but we're gonna have to stabilize the melanocytes pre and post the laser with certain skin conditioning so that your melanocytes don't become overzealous and hyperpigment when you receive the laser for the scar. So first you have to say, what type of scar is it? Is it hypertrophic? Is it textured, meaning like is it like a bound down thickened scar, or is it darker? Is it hyperpigmented? Is it lighter or depigmented or hypopigmented? So it just all depends on the morphological changes of the scar, and that determines what laser you choose. And then depending on your skin color and consistency and like the type of skin you have, what area of the body it is, we decide what laser that we're going to use, what settings we're going to use, how many passes. There's a lot that goes into it. And sometimes what we'll do is we'll have somebody come in and we'll do different test spots. So we take like a white eyeliner pencil and we make a grid on the scar, and we test different settings on the laser to see which one responds best, and then we treat the whole scar with whatever gave the best outcome. I hope that makes sense. So all right, cool. Let's see how we're doing on time. Okay, we seem to be doing pretty good. Okay. All right, can you share your routine and reapplying sunscreen at the beach or throughout the day? Okay, so I always put on my sunscreen in the morning, right? And then I usually reapply it throughout the day with like a powder. I have the Color Science powder, mineral powder, sunscreen, and I'll kind of dust it on my face. If I'm, we have windows in our office, when I get a chance in between patients, I'll do that. And then at noon, sometimes I'll just reapply my Color Science. I'm really neurotic with it, and I don't wear makeup on my face, so I don't have to worry on my skin. I wear it on my eyes and my lips, but I don't wear makeup on my skin, on my face, so I could just reapply it and it's not going to mess up my makeup. But if you do wear makeup, I would say either reapply it and then apply your makeup again over it, or if you're at the beach, I just think layering on your sunscreen is better than like always washing your face or taking like some type of cleansing pads and God forbid you use makeup wipes and then reapply your sunscreen. I just think layering it on throughout the day to reapply is fine. If you're not like outdoors on the beach all day and the UV index isn't high, like right now it's January, I live in a beach town in Laguna, so it's still sunny, but I'm indoors. I don't reapply like as diligently as I do as if I'm on the beach in the summer, where I set my timer on my phone every 2 hours and I just I use the Color Science Facial Classic because I don't have to worry about the color mixing and matching, like the flecks and the different colors and things like that. But I'll reapply the actual liquid sunscreen every 2 hours. When I'm in the office, I'll just use the powder, and then when I'm like leaving home, or I leave the office for a little bit in the early afternoon, like I don't leave at 12, but I leave at like 2 or 3, and if it's still light outside or if I'm going straight to the gym, I reapply like the liquid sunscreen. So you don't have to reapply the actual liquid sunscreen. I don't feel like every 2 hours when you're indoors, but on the beach or outside, I definitely do. And you can even take a beauty blender. You can even take like one of these guys and just put your sunscreen on it and just kind of like touch it up. And some people say as long as you keep them clean. I have some Hibiclens here at my bathroom, and I just will Hibiclens my beauty blenders like once a week just to keep them clean. But it's a good way to reapply your sunscreen. And then it's like you're just putting on makeup. It's not like you're getting this goopy white sunscreen all over the place and under your nails and all that stuff. So hopefully that makes sense. Okay. Love your lip mask. Oh, good. I'm glad you guys are loving it. Why do you use tretinoin on your neck only once a week? So I do tretinoin on my face and neck once a week. And on the other days, I use my RxR retinol, my MDR RxR retinol, which I feel is the smartest retinol on the market because just all the technology, all the innovation, I just take it straight from the medical community and put it into the products. I don't have to wait for a third person party middleman to, wait 6 years before the technology gets into the mainstream, skincare lines. I could just engineer it directly for my patients and have it from the research labs to the products to my patients and to myself. But the reason why I only use a tretinoin once a week is because that's what my skin tolerates. And because I'm using, my vitamin CFK, my RxR retinol, I don't have to use my tretinoin every night. I used to use a tretinoin every night. Even in my early 20s, I used to use, the tretinoin 0.05%. And now I just actually do the 0.025% on my face and neck. And I mix it with my NMF hydrator. And I just do that once a week. So I think my skin is good and it really doesn't need it more than once a week. I know that there's some people that say you need to use it at least 5 times a week. There's no real data supporting that. I think there's a lot of fear mongering and marketing ploys out there, but from my own experience and for my own skin, that works best for me. But if everyone's skin is totally different, especially when it comes to tretinoin. So don't get hung up on what other people are doing or what your sister's doing or what your friend's doing. Like don't get hung up on a percentage or a frequency, because that, even if you're on a consistent schedule, like you may have a curveball thrown at you and you go skiing in Mammoth, or you go, to a climate where it's cold and dry or where it's humid, and like your skin will change and respond differently to the tretinoin than it was before. So just keep that in mind and don't get hung up on the frequency. It's not that big of a deal. Less is more, and slow and steady wins a race always when it comes to tretinoin. Okay, so let's see. Oh my gosh, am I missing so many of these? Dr. Stephanie, why do you think of the Fraxel 1540 laser? Fraxel is usually 1550 or 1927. There's also a Fraxel CO2, which should be a 10600. So I'm not sure about the 1540. I have to look into that. It's probably not a Fraxel, because Fraxel is kind of the name brand laser from Solta, and I'm not familiar with the 1540. I don't think they have one. There's probably another 1540 nanometer wavelength laser, so I'll look that up and get back to you. I love all the science-backed explanations. I know, don't you love it? I don't have to look this up. I have like a little computer in my brain and I can just spit the answers out to you guys. But you guys have such great questions. I love this and I can talk about this all day. Okay, we have 2 minutes left. I'm gonna try to give a, hi Rachel, oh my gosh, it's so good to see you. I saw that picture you posted of yourself. Your skin is gorgeous. It's so flawless. It's so good to see you on here. Tell your mom I said hi. A provider in my area is always recommending Genesis and XLV laser to my mom and I. What lasers are these comparable to? Okay, so Laser Genesis is technically a YAG laser, which is a 1064 nanometer wavelength laser. Laser Genesis is actually really, really good. There's no pain, no downtime. It's basically like a lunchtime laser. It's not like that potent, but it does some anti-aging. Supposedly, it helps with tightening, collagen stimulation, and I believe it can help with hyperpigmentation too, but it's very baby, like it's very weak, which your skin is perfect, so you don't really need that anyway. I personally know her. She's amazing. She's an incredible patient of mine, but I feel that it's very weak and it's not very strong, but it's a good like one to do if you just want to keep your skin, you know, stimulated and you don't really want a lot of discomfort or downtime. So I do like that. I would say Laser Genesis is probably most equivalent to Pico toning from Pico. So with the Resolve handpiece. So that's what it's most comparable to. XLV is just basically, it's a 532, 1064, I feel like nanometer wavelength laser. So the 532 XLV, which is probably what she's recommending it for, or he or she, the provider, is like a V-beam. So you can compare it to a V-beam. So XLV does have 2 wavelengths. The 1064 wavelength on an XLV usually is used to treat like blue-green veins around the periorbital area, but the 532 is used for like facial redness, facial flushing, rosacea, telangiectasias, things like that. Everything that you would use a V-beam for. So I hope that answers your question. It's so amazing to see you on here. Okay, somebody says, don't water it down. Love the scientific explanations. I found my people. I love it. I love it. You guys love that. I love all the science too. So exciting to hear from you guys. Okay. Can you tell us what you think about at-home microcurrent devices? Okay. All right. So at-home devices, you guys have to be very careful because they're very expensive. Some of them work, but some of them don't. And it can not only just drain your wallet, but it also can drain your time because some of these take a long time. So with the microcurrent devices, I do think they do something. The problem is that it doesn't last. So it's like you're putting air in a tire with a hole in it. Like I'd rather spend money on something that's going to last for 6 years like Thermage, or 1 to 2 years like a laser, you know. So microcurrent devices, I think they tighten, but it's only temporary, so you have to keep doing it over and over again. And if I understand correctly, one of my patients told me that you have to keep buying the gel that you use to do the device. So you're like having to go through this consumable and, you know, the company's like cha-ching, 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 you know, and you're using this gel and you're getting this temporary result. So that's what I think about microcurrent. Just make sure if you like it and you're okay spending money on it and spending your time doing it, and it may not last for more than 24 hours, then I think that's fine. If you're informed of that information and you're willing to go through with it, then I think it's fine, but it's not like my favorite and it doesn't have any like long-term results. I'm all in about like stimulating your body's own regenerative processes and long-lasting results that are going to down the pathway of life on your journey, going to keep making you better and better. So that's kind of my rationale. Can you do V-beam? Absolutely. I love V-beam. I do V-beam on my face all the time. I do it on my patients. I love it for erasing dark circles under the eyes. I do V-beam under my eyes a couple times a year, and I love it. It helps erase dark circles, and then it limits your need for concealer. Although the lighting in here is terrible. I'm just on my iPhone like streaming this right now. So, you know, I don't know if I probably have mascara underneath my eyes right now or shadows. V-beam and Pico on the same day, absolutely. You can combine these 2 lasers. It's a great treatment. We often combine V-beam, Pico, Fraxel, and that's chef's kiss, dude. That like, when you do V-beam, Pico, Fraxel, so Fraxel is going to make everything better. It's going to shrink pore size, stimulate collagen, help smooth out fine lines and wrinkles. The V-beam is going to retract the blood vessels so you don't get that ruddy appearance. It just helps minimize rosacea, facial flushing, blood vessels, and then on top of that, Pico is going to come in there and just spot treat those little stubborn brown spots. And when you do all of those, your skin's like perfection. So that's one of my favorite triple combinations to do. Okay. Someone said, I was recommended Thermage for eyes and therapy for jawline. Should I search another provider who does Thermofrax for eyes and Thermage for jawline? I mean, yeah, I think it's totally up to you. I personally, between Thermage and therapy, I love Thermage. I've had them side by side in an office for years and years and years, and Thermage always performed better, but it is operator dependent. So you need a new device, not a refurbished one from a third-party laser broker from 2005. You need a new device and a provider who knows how to heat stack, do the vectors, super pass, all that stuff, because half these people doing Thermage are like turning it on and just doing, like, not even knowing what they're doing, or really aware or thinking about the physics and physiologic changes that the radio frequency is doing in the skin. So you have to think like that. If you're just kind of like a, just like a machine going through it, like, you're not going to get the results. But I think you should be fine. And, I would pick Thermage instead of Ultherapy for jawline, because I've done it 4 times myself. I did it at 30, 35, 40, 45, and it's been one of the best things that I've done for my lower face. I wish I did it on my neck 4 times. I did it on my lower face about 4 times. And then I think Thermage should be fine for the eyes. You don't have to use Thermoprax, for those of you who don't know Thermage. But Thermage is a radio frequency device that stimulates collagen deeper. And then Fraxel is a laser, so photons, not radio frequency, not energy based. It's a laser because it's color-emitted light photons at the superficial portion of the skin. So when you do Fraxel combined with Thermage, you get a full thickness collagen stimulation, and it just packs a punch, especially with the under eye area. Now, a lot of people say, my provider won't do Fraxel around the eyes, my provider won't do Thermage around the eyes, and Thermofrax is both of them, so they're definitely not going to do that, because you need 2 things. You need a clinician who knows how to put in an intraocular eye shield, which is, I could do it in 2 seconds now. It's easy, but it took me 10 years to get to that point. Like, putting in eye shields isn't easy, and you want to go to a provider who you know and trust, and many people just don't want to mess with it, especially like Medi-Spa level providers who don't have a high skill set. They're not going to be able to put an intraocular eye shield in, and they probably won't have the specialized tip that you need for the eyelids. Eyelid skin is different skin. It responds beautifully to lasers and energy-based devices, but you need a special eyelid tip. And then, of course, you need to know how to protect the eyes. So people just get squeamish and afraid of the eyes because they're just like, that's not their area of expertise. They're uncomfortable enough in the specialty, kind of just coming in last minute and Googling how to do Botox, but doing periorbital Fraxel or Thermage is something that's not in their wheelhouse, which is why a lot of providers don't offer it. So if they offer Thermage around the eyes, make sure they're using the green, it's a green color, eyelid handpiece. I love just giving you guys information and education to protect yourself, to make sure that you're getting your bang for your buck. Make sure they have a Thermage eyelid handpiece. They're going to put intraocular eye shields on. If they're not going to put eye shields in, they're not going to even get close enough to the eye, or they'll use like a face handpiece and get kind of close to the eye and be like, oh, there's your under eye Fraxel. That's not under eye Thermage. Under eye Thermage is getting right up to the lid margin, getting like snatching all that skin up and tightening it all up with that eye shield, and so you can get right up close and over the upper eyelid down to the lash line. Just heat stack those pulses to stimulate collagen and elastin. And that's, everybody asks me what I do under my eyes. That's like my go-to, and I've been doing it since my early 30s. So to answer that question, I think you're okay with Ultherapy for lower face, but if you have a choice, I would do Thermage. It's okay if they don't do Fraxel, if they only do Thermage around the eyes, but make sure they have an eyelid handpiece specifically for the eyes. They put in an intraocular eye shield and check their credentials and make sure that they, have been doing this for a long time. They're very comfortable with it, and ask to see their own before and afters. Don't ever feel bad asking your provider for their credentials and questions like, how many of these have you done? How long have you been doing this? Where did you train? Who trained you? Why do you have this device and not another one? I know people come into my office with lists. They open their phone and their notes and they have lists, and I love it. They should be like, it's your face. These people are going to be you're trusting these people to treat your face. You're paying money for it, and you don't want somebody who doesn't know what they're doing, and don't feel bad asking them and interrogating your provider. I get it all the time and I love it. So hopefully this will be helpful. I'm going to close it out now because it's been 30 minutes. I love you guys so much. Thank you for all of your questions, and if you like this format, I can do a live Q&A with you guys once a week, and then next Sunday we'll do another video. It's going to be a good one, and let us know also what you want me to post on, because I'm here to answer your questions and be your support system. All right, have a good Sunday, you guys, and I will see you next week. Let me figure out how to turn this off.